Yes. Beautiful people, it's me, Frank Donga, your number one job seeker, bringing you some undiluted or gist this time of the day. I know say you like gist, and just like me, you like gist. I promise you the one. Today again, we shake your health. It will shake the health of your family and everybody around you. Why? It's because we are talking about our health, taking it seriously. I'm not alone. As usual, there's a fantastic health expert here with me, and together we're going to be dropping this gist on you. Wow, just like that. I didn't send myself this gist though. Neil is powering this gist. So wherever you are, at home, at work, at play, at sleep, eyes open. Call your friends, call your neighbors, your enemies, everybody. Let's hear this gist together. I'm coming.
Hello, Doc.
With Frank Donga.
Hello, Doc.
You're listening to
Hello, Doc. With Frank Donga.
Now, you've heard this conversation before, that I want to mind my business and just drink water. Why don't you mind your business and drink water? You should mind your business and drink water. Everybody wants to mind their business, all right? So now the point is, this other conversation comes up and says, not be you go tell me what I go do, meaning you're not the one who's going to tell me how to live my life. Everybody wants to do their thing, individualism, me. That's what we are doing now. On social media, to tweet it, they say it everywhere. People show it. Don't tell me what to do. Mind your business. Don't tell me how to live. Don't tell me what. You're not the one that will tell me, me. So now, the question now is there any implication of minding your business as far as immunization is concerned? If I mind my business and only immunize myself, does it concern you and your family and your children? If you mind your business and just immunize and keep to yourself, does it affect anybody? If you refuse to mind your business in court, does it affect anybody? What if you mind your business by not getting immunized or not immunizing your children? What happens? Now, remember that my guest I told you about, that health expert who's going to join us today to drop the gist with me? She's in the studio. She's in the studio. And hot, we're going to be dropping the gist with you. That guest is no other person but Dr. Anire Chima Oduko. You're welcome. She's a public health physician, passionate about the health and the well-being of women, adolescents, and children. And she does all this via medical outreaches, health screenings, health education, and other evidence-based public health strategies. She's an associate fellow of the National Postgraduate Medical College of Nigeria, and she's also a member of the West African College of Physicians in the Faculty of Public Health. She's a published author and a health speaker. You see, you'll be small matter. You're welcome, Doc.
Thank you for having me.
So, Doc, this era of I've just drink water and mind my business. I mind my business and drink water. You're not going to tell me how to live my life or do my thing. It doesn't concern you. What is the implication of me deciding not to take immunization or get my kids to be immunized? What impact does it have on my neighbors, my friends, my family, on you, or the society at large?
Okay. Thank you for that question. Very important. Like you said, everybody wants to do what pleases me. But we know that our action or inaction affects other people. And this is very true for immunization. So now, we live in a society where we are always in constant interaction with other people. You work, you go to work, you go to the market, you go to schools, and disease-causing agents are everywhere. When they affect you, a person can transmit it to another person. Okay? So if you decide not to immunize yourself, that's fine. But you're placing other people at risk. Because if you get the disease, which other people are scared of, you can transmit that disease to other people. Same thing with your children. A child that is coughing, we all know mothers know this, that when school just resumes, that's when there's an increase in respiratory infections, because a child that has been well during the holidays goes to school and starts coughing. Why? She got it from someone else. So it's very important we immunize ourselves, because if you do not only are you placing yourself at risk, you're also placing other people who will come in contact with you. In immunization, there's something we call herd immunity. Herd immunization. Herd immunity, which is immunization that a whole group gets because certain people are immunized. A herd is a group of cattle. So using that for immunization, if let's say 80% of people in a population are immunized and 20% are not immunized. If a disease agent wants to come and it meets you that are immunized, it protects the people that are not immunized because there are not many susceptible people for the disease to affect. So herd immunity is a situation whereby the whole population, 100%, is immunized because a large percentage of people are immunized. And so it's hard for there to be an epidemic.
So it's like you have a fence outside the gate. So even if somebody is vulnerable inside the gate, at least the fence will protect any
Some
intruder
people,
from.
yes, the first people, if a lot of people in the community are immunized,
They will form that fence.
yes, that protection.
Mm.
Because more people are immunized, so the disease cannot affect them. So they kind of shield you. So we want more people in a community to be immunized so that the whole population can be protected. However, when not enough people are immunized, it means there are more people that are susceptible. So if the disease comes to the environment, there are a lot of people it can affect that will not affect another person, that will not affect another person.
Oh, so the more the people that are able to get infected, the faster the disease might spread.
Yes.
And it will get
lead to an
everybody.
epidemic.
It will touch everybody.
It will touch everybody.
Like very fast.
Yes. But if a lot of people are immunized, so it comes, it sees that okay, this first person is immunized, the second person, it cannot spread. So there's like
that's like devil's basket. That's this game. What do you call it? Is it devil's basket? What's that basket game? And then you pass it to you, pass it. Remember that game you used to play when you were
okay, I'm maybe so.
If it gets to your turn and the music stops there, go be.
Hello, Doc.
With Frank Donga.
Hello, Doc.
You're listening to
Hello, Doc. With Frank Donga.
If somebody now decides that, okay, I don't want to get immunized for whatever reason, it now becomes everybody's problem.
Yes, it becomes everybody's problem.
What impact would that have on maybe the economy of the society?
A lot. Immunization is something that can affect an economy because when there's an epidemic that affects the whole country, it means the country has to put resources to take care of that epidemic. There needs to be health personnel that is recruited to. So you're spending more. So money that could have been used to do something else that will benefit the community is being used to fight that disease. So yes, it affects our economy. And if it's a serious disease, it can lead to lockdowns.
Nobody wants that.
We don't want
Noisy.
lockdowns. It can lead to lockdowns. It can lead to limitation of movements. Okay, you cannot. So it can affect the economy. Schools, yes, they'll close down schools.
Entertainment industry. No more nightlife. No cinema.
Don't come to school. Don't do this. So economic activities will be affected. We know that. So yes, it is an economic business, immunization. Yeah.
Is it still possible for some of these diseases that you're trying to prevent with immunization from childhood? Is it possible that, I'm just saying, that if we're not careful, they can just, boom, come back and catch a huge population of people if we don't pay attention, or they are gone for life?
No. So that's what's even happening now. In America, they used to have measles before immunization came. A lot of children used to die from measles, but when they started immunizing, it dropped drastically. However, due to this thing you talked about, when people say you can't tell me what to do, I make my own decisions, and people are refusing to vaccinate their children, there's now a resurge of measles cases.
Wow.
What was not a problem is becoming a problem. So yes, it doesn't mean that because we've immunized against it, it cannot come back again until we reach what we call eradication, which is when you tear out a disease from the roots and destroy it from the world. Any disease can always come back. So new diseases are coming back. We have what they call emerging and re-emerging diseases. So re-emerging diseases are diseases that used to be a problem in the past. They were controlled, they stopped, but they are now coming back due to some of these factors like lack of immunizations and other factors. So yes, it can happen.
In other words, now what you are saying is that you cannot just form is my business, and if I like, I immunize. If I like, I don't immunize my family or myself. And you are saying it will affect all of us. All of us will be chopped. It's like national breakfast. Last. If you reach it, go touch everybody.
Yes.
If we don't immunize, the disease go touch everybody. In that case, doctor, let's just make it compulsory. Let's force people to immunize now, Abi.
No, we don't want to do that.
Why?
We can't. We shouldn't make it's immunization is our civic responsibility. It's a good thing for everybody to do. It's good for you to take care of yourself and take care of others. But let's use voting for example. It's our civic responsibility to vote. But does
To
everybody
vote? For
vote?
the leader you like.
Oh, but this is not voting. This is more of life and death, rather.
Mm.
So yes, we don't want to force people. We don't want to do that. No, we advise people. So health promotion is all about allowing people to take decisions about their health that'll be beneficial for them and the whole community. So we don't force anybody.
I like your
Yes, we
approach.
don't
I
wanna
like
do
your approach.
that.
Your own is better. Just like mosquito matter,
Yeah.
and stagnant water.
Mm-hmm.
If you don't clear your gutter
Mm-hmm.
and make sure that water is not standing, mosquito will come and lay egg and increase population. And the mosquito that will come out of that gutter will not bite you only, it will bite your
everybody.
neighbor.
Yes, and everybody will be
Mm.
sick. You
It
got
also
it.
reminds me of throwing refuse inside the drains. If
Eh-heh.
you drink pure water, you drink biscuit wrapper, and you dump it into the drain in
It's
the
not
community,
good.
if it blocks, and the flood
Exactly.
will come. The
Everybody
flood
will suffer. You know,
break
you're in the
fast
spirit.
on a general level.
Yeah, you
That we
know
want to
now.
prevent it.
We
Thank
don't
you very
want to
much,
do that.
Dr.
Thank you.
Anele.
Thank you for having me.
You don't hear him now. I will do me. I will do me. It's my business. It doesn't concern you. It will concern everybody last. If you refuse to take care of your health, that is why it's important to be your brother's keeper, to look out for not just yourself, look out for other people and make sure those routine immunizations, you ask questions and make sure you protect yourself against diseases with all this available routine immunization. Just in case there's something on your mind you want to say, you want to free your mind, say what's your mind, and you have phone with data and social media, why not just tweet at us or upload your post and tag us at Niyel Campaigns, at Niyel Campaigns, Niyel Campaigns, at Niyel Campaigns. Don't forget to use the hashtag Change Creators. What did I say? Hashtag Change Creators. And everything you tweet at us or tag us in, will respond to you. Like I said, this gist, hot gist, is powered by Neil. Thank you very much, guys. You are always a wonderful audience. Hang on there and watch more episodes and listen to more of these podcasts. Hello, Doc, with Frank Donga. See you next time.
Hello, Doc.
With Frank Donga.
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 Hello, Doc.
Yes. Beautiful people, it's me, Frank Donga, your number one job seeker, bringing you some undiluted or gist this time of the day. I know, say you like gist, and just like me, you like gist. I promise you the one.
Of people not wanting to vaccinate themselves and how it affects the community. So it's time for feedback from you. It's time for a conversation. What do you think? The question I would like to ask today, if you listen to the podcast I played and you heard how people's decisions on not vaccinating themselves or their children can affect other people, how do you think society should respond to this? So, how do you think we as a people, what should we do to others that say they do not want to vaccinate themselves, knowing that that decision can affect us as well? What should be done? If a policymaker is listening to this podcast or this radio broadcast, what do you think should be the decision he would take? So the phone lines are open. Call us, talk to us. It is 0700 993 993 993. For women, you can call me on 01 4657 190. You can send a WhatsApp message to 0809 597 5805. And we know we have a very short time for conversation. So even after this ends, you can follow me on Instagram to continue the conversation. So if you wanted to say something, you have a contribution that couldn't come in, you can follow me on Instagram. I'm Dr. Anire, Dr. Dr.Anire, and send your comment, question, contribution, and we will treat it. Okay, so yeah, what do you think? Let's talk. This conversation is very important. Once again, the phone line to call is 0700 993 993 993. Women, you can call on 01 465 7190. The WhatsApp line is 0809 597 5805. And you can follow me on Instagram, Dr. Anire, dr.anire. So some of the things we said in the podcast that just played was that when people refuse to immunize themselves, they can have an infection that they can, especially for an infectious condition, they can have an infection that passes. Okay, we have a caller.
Hello.
Hello, welcome.
Hello, good afternoon.
Good afternoon. What is your contribution?
Is that Nigeria Info?
This is Nigeria Info.
Okay, my name is John. I'll let you know. I'm calling from Ikorodu.
Okay, welcome.
All right. I think many people don't like taking vaccination. One of the reasons is because of its religious belief.
Okay.
And yes. I remember when I was serving in the north, in Katsina especially, and we saw vaccinators came to a community where we were working, and the father of the children now told those who came for vaccination that why should they come and vaccinate their children? This is a Christian something that how much government give to them to come and vaccinate their children.
Okay, so you think? What about religion do you think is against immunization, or what did they think was against immunization from the religious?
They are saying that it's not Islamic. That it's a Christian something. It's brought by the white men who are Christians.
Okay.
So they chased them away, and we were telling to them that look, vaccinate your children. They say no, it's God that takes care of children. It's not
okay.
Whatever. So that's their belief.
Okay.
They give, and that's the reason why they have them all over the town, that they are crippled.
All right.
Because
Thank you for your contribution.
Everything is from God.
Thank you for your contribution. This is well noted. Thank you very much. We have another caller. Welcome. What is your contribution, question to this topic?
Okay, I want to say that when you have received a vaccination, you're supposed to be immune. So why would you bother about the people who are not vaccinated?
Okay. So is that a question?
That's a question.
Okay.
Thank you.
Okay. So if you listen to the conversation, I talked about herd immunity. So herd immunity is if a lot of people are immunized, it can form a defense for the whole population. So your action can actually affect other people. For example, I gave the example of if you have children and they go to school, when they resume, you notice that they come back home with cough, catarrh, upper respiratory tract infections because they got an infection from someone else. Children play a lot, so they get diseases from other people. So it is possible that a child can catch a disease from another person. So the whole point is, when a lot of people are immunized, it protects the whole community. So we shouldn't just be about ourselves. We should also think of others. We have a caller.
Hi, I was the one that called before.
Okay.
I heard your answer, and I hear you.
Okay.
But you still haven't really answered or hit the nail on the head. Because if you take a vaccine, that vaccine is supposed to make you immune, right? If you believe in the vaccine, if you know that the vaccine works. So when you talk about someone vaccinated that is going out and getting infected by someone who isn't, does that mean A, the vaccine isn't working? Or if that is the case, why was the vaccine taken in the first place if it's not going to protect you?
So we are talking about the community implications of non-vaccination. We are talking of people that refuse to vaccinate. They don't. So it's not about people that have vaccinated. It's those who do not vaccinate. So those who do not vaccinate, they increase the threshold for an epidemic. Because we know that a few people might not vaccinate, but those who are not protected can increase the threshold for an epidemic. They can make diseases spread faster. So that's why if everybody is immunized, we don't have to bother about that. But those who are not, okay, we have another caller.
Good afternoon, Doc.
Hello, good afternoon.
Well done.
Thank you.
My name is Maxwell.
Okay, welcome.
Nice conversation. And honestly speaking, I understand the angle where most people are coming from.
Okay.
As a father, and I believe whilst I was young, definitely, of course, we went through some types of immunization, and that's the reason why we are here today. But the problem is, I believe, is one, first, most people, based on one of the things one or two of your callers have said, convince them it's important you take this. So, for example, for crying out loud, some days back, my child was kind of having cough, all right?
Okay.
And catarrh. So I do this most times. I, like the father thing, I suck the mucus from his nose. Okay?
Mm-hmm.
After like 2 days, I noticed that I started having catarrh, serious one.
Okay.
You understand? So easily, he had to just pass it to me because of what I was doing, okay?
Mm-hmm.
But because I had an immune system that was much stronger, I could easily, because I didn't really take anything. What I did was I just stopped what I was doing and I started taking hot water. And
okay, sorry to interrupt you, but I get what you're trying to say. So your immune system was strong enough to defend you from the infection. However, there are some people whose immune systems might not be that strong. So a disease that would you can recover easily from, the other person cannot. It happened during COVID when we were saying that older people with chronic conditions are more likely to die from the disease, but young people were not at much risk. So does it mean those people who are not at much risk should not be immunized? Because when they are immunized, they protect those weaker people who might die. I don't know if you, so if you're listening to a lady caller that called and asked her question. So these are the reasons. It's not just about yourself. If you are vaccinated, why should you bother about other people? Other people are not. Everybody is not at the same level health-wise. But when you get immunized, your likelihood of passing the disease to others is low. Okay, we have another caller. Welcome.
Good afternoon.
Good afternoon. 99.3. What is your contribution? Good afternoon. I can hear you. Please lower your radio.
Yes, I've done that.
Mm-hmm.
Okay, can you hear me?
I can hear you.
Oh, okay. Now I want to confirm. Like, for instance, now, to what extent can someone say that my immune system is stronger or things like that? Apart from maybe self-built soldiers, which is called immunities and all that. So, is there any other thing that can, maybe lifestyle, that can defend someone from, being susceptible to attack?
Yes.
For instance, now, one thing about me, personally, is that if I go to work like maybe 2-3 times in a week, Lagos traffic and things like that, and I have this feeling of maybe dizziness and stress and all that.
Please, can you round up so that we can?
Once I just relax, 24 hours. So I get kick up again. So should that have to do with immunity and things?
Okay, thank you for your call, your question. So immunity is dependent on a lot of things. Is dependent on your age, your lifestyle, the kind of foods you eat, and your own predisposition to disease. And then one of the things that improves and increases our immunity, apart from eating well, taking a lot of fruits and vegetables, is immunization. And that is why we are preaching it, immunization. It protects against diseases that could have come and even killed us. Okay, we have a caller. Hello, welcome.
Is that Nigeria Info?
Yes, 99.3. We lost that caller. We lost that caller. You can call back 0700-993-993-993. And women 014657190. Send me a WhatsApp message 0809-597-5805. After the conversation ends, send me a message on Instagram. You can comment on our post, Dr. Anire, Dr.Anire, Dr.Anire. We have a caller.
Hello.
Hello.
Yeah, is that Nigeria Info? Hello.
Hi. Yes, it's
Is that
Nigeria.
Nigeria
Yes,
Info?
Nigeria Info. You're welcome.
Okay, Daniel's here.
Okay, yes.
So I
What
want
is
to
your
ask you a
contribution?
question.
Okay.
For example, the COVID vaccine,
Mm-hmm.
does it prevent transmission of the disease?
Okay. Okay, so it doesn't prevent transmission. Disease can still come, but it improves and increases your capacity to fight it. So it depends on there are many factors that that influence whether disease happens. The strain of the organism, how high it is, your own immunity, your own immune levels are all dependent. So when you're immunized, it boosts your immunity. So you can still come down with disease, but a lesser form, a form that is not as severe as if you were not immunized at all. So we have another caller, and I'll take
Hello.
Hello, welcome.
Yes, good afternoon.
Good afternoon, 99.3.
Okay, yeah, Samuel.
Okay, hello Samuel.
So,
What's your contribution?
My question still, goes in the direction of the last caller. Is it this COVID sort of a thing? Yeah, like me, I didn't take any.
Okay.
Hello, can you hear me?
Yeah.
I didn't take any. And now that COVID has gone now, is there any for me to take? And me that I'm sure my immunity is 100%.
Okay,
anything.
yes. So if you are sure your immunity is 100%, that's what we're trying to say. It's also not about you. It's also about others. You mix with other people. You go to church, you go to school. When you go to church, there's an old woman there who has hypertension, who has a disease you don't know about. She shakes you, she hugs you, you give her the disease, or because it doesn't mean you might not still have the organism. It's just that it's not affecting you. You pass it to her. She is not immunized. And so it's get immunized. It protects other people. Okay, that's just what we are trying to say. So your actions can affect other people. So I'm going to take some WhatsApp messages. Someone said, "Hey, Dr. Anira, the choice is to not vaccinate is a human right. With COVID, it is clear that the narrative of do it for grandma was a big lie. Vaccines have harmed lives, and you know it." Okay. So we don't. All those are. So in medicine, there's something called evidence-based medicine. So show the evidence, not by hearsay. So research has been on. He said something about autism has been linked to vaccination. That is not true. It's just people's speculations. There are things like myths and misconceptions. What research has proven that it causes death. So this is why we have what they call it re-emerging diseases, resurgence of diseases. Please, we have another caller. Let me just take that. We have a lot of messages on WhatsApp. I see you, and I will respond. Hello, welcome. 99.3. Please keep your comments and contributions short and straight to the point. Okay, we lost that caller. Today the topic has been very hot, and I like that. Hello, welcome to the show.
Good afternoon.
Good afternoon, 99.3. What is your contribution? Please keep it short and straight to the point.
I want to know, I took COVID-19 the first dose. I want to know if I want to take the second dose. Can I take both the second and the third dose at a go?
No, you cannot. You cannot. You have to follow the schedule. Okay, so I need to round up now. Our show is almost over. There are a lot of questions I've not answered. Please follow me on Instagram if you have a contribution, you have a question, and send a comment, a message. I will respond. Okay, thank you for listening in today. It has been very interesting. It has been very fiery. A lot of questions. We still have the same conversation next week, and we'll take another topic on vaccination. I'm Dr. Anira Chima Oduka. This program is powered by NIEL, and our aim is to improve immunization in Nigeria. Thank you for having me, for listening. See you next week.